Well, to go further into the topic of suicide prevention, we are joined by Douglas Jacobs in Boston. He's a consultant for the Adult Suicide Prevention Project in Massachusetts and an associate professor at Harvard Medical. Welcome.
Thank you for having me.
Is there a way to quantify, I mean, these high-profile deaths that we've seen of late, but is there a way to quantify suicide as whether it's really generated by people with mental illness or people who are going through something, a difficult time, let's say a job loss, the loss of a family member, something like that?
Well, I think you need to separate out those two parts of that question. Our studies indicate that 90 to 95% of persons who commit suicide have some type of mental illness, primarily depression. It could be substance abuse or psychotic disorders. However, the occurrence of suicide does happen in the context of social situations, whether it's loss of a job, loss of a family member, or tremendous self-esteem issues. I agree with a lot of what's been said, in your previous discussion. It is important to talk with people who are struggling with suicidal thoughts. Don't shut them down, but to take those conversations seriously in the same way that you would approach someone who is having chest pain or choking. You would get that person to help. The suicides that you mentioned, both of prominent, admired, both a man and a woman who had touched lives of many, many people, can trigger either the onset or increased suicidal thinking in those that are struggling with mental illness or in families who have had suicides that are survivors. So the idea of reaching out at this time and in a sense having shows like you're doing to let people know that yes, suicide is related to mental illness. It can be contagious, but the most important is that there are things that you can do. Even though there's been an increase in the suicide rate, there's also been tremendous advance in how we approach suicidal patients in terms of our advanced psychotherapies, medications, the development of what we call safety or crisis plans, which involve everybody. And a way I like to think about this is that the prevention of suicide is everybody's business, whether it's the media, friends, families, co-workers, classmates, and that the way to approach it is, in a sense, getting that person to help.
When you talk about mental illness, what do you mean? Depression?
Primarily depression, mood disorders, whether it's depression or bipolar illness, which is both manic and depressive swings. 50 to 60% of all persons who commit suicide have some type of what we call mood disorder.
Alrighty, well.
And to be specific, depression, the illness, is different than having the blues, where one may feel down or upset. Depression has specific signs and symptoms that affects not only your mood, but bodily functions such as sleep, appetite, energy. It affects the way you think in terms of concentration, feelings of hopelessness, and of course the most serious is thoughts of suicide or death.
All righty, well, Douglas Jacobs, we're going to have to leave it right there. We appreciate your time on this very important topic, and if, of course, anybody's having these thoughts, there are the National Suicide Prevention Hotlines in your area to reach out to.